Sexual torture is a particular type of torture that is extremely difficult to talk about. And it's not just by women, it's not just by men, but there are differences along gender lines. There are differences according to where you come from and cultural norms in which you grew up in, and how easy it is to talk about general sexual matters, talk about the anatomy of a male, female, non-binary people. You know, it's even in the regular medical assessment without torture, it's very difficult for a lot of patients to talk about that. And it's also sometimes difficult for clinicians to talk about that, to bring this up, let alone when it's part of the worst day or period of time that somebody has gone through this kind of experience. So there are issues of shame, there are issues of fear, there are issues of stigma, cultural issues, and of course those go both ways. They're all on the part of the survivor and on the part of the clinician who's trying to get this testimony. So part of the standardization is, how do you ask these questions in a way that is least troubling to the individual? Oftentimes I hear people say, well, what about re-traumatization? Maybe we shouldn't do it. That is from my personal view, is that I think, while I 100% agree that re-traumatization is a risk, I think sometimes we use that to avoid going through the process. Oftentimes, in my experience assessing torture survivors, sexual torture survivors, is that oftentimes they do want to tell their story, and there is a therapeutic element to undergoing this evaluation and the documentation. So we train physicians how to do this in a way that is trauma-informed. There's a trauma-informed way of doing the interview. There's a trauma-informed way of doing the physical examination, and then putting this all together in a consistent and standardized approach that uses standardized language to say what it is that they can't say. They can't say this person was raped. You weren't there, you can't say it. But there is a way of saying their scars, their mental health manifestations are consistent or highly consistent with the stories that they allege happened to them. But also, it's about trying to normalize this as much as you can normalize sexual torture. But for example, if you think about a person you're seeing in front of you who may not be disclosing this, but you know that they're in a custodial setting where oftentimes sexual torture occurs, you know, there's a way of asking the question. For example, I know that we hear, or throughout my career, I've heard of many people in your situation who have had experiences involving their genitalia. Did anybody ever touch your genitals in a way that you, somehow wasn't right in your mind? And so part of the training specifically on sexual torture is training the clinicians on how to ask these very difficult questions. They're never fun to ask. 9 out of 10 times, survivors don't want to disclose. And there are all kinds of different techniques of interview techniques. There are physical examination techniques to ask them, and specifically also not assuming that at the end of this visit or at the end of the assessment, that if they didn't disclose, that it didn't happen, and then coming back to it in a way that is as gentle as possible, that is as less stigmatizing as possible.